Okay, so that's that one. Now this is moving on to a Norwegian study. The author's Tor Iversen, who actually I know reasonably well. He's from Oslo. Now, he was absolutely clear throughout his paper. It's always associations, associations, associations. He doesn't want anybody to think that he's saying anything about causation. And so he had quite rich data set for 1998. And the measures he was looking at, trying to explain, were self-assessed health, a general health measure, and also a measure restricted to mental health. So that's what he's going to try and explain. So this is individual level data, and he's trying to explain differences in people's self-reported health, general health, and also in their self-assessed and reported mental health. And so his series of measures he looked at, things like has at least one close friend, and we came across that one on Friday. Married or living with partner. Lots of Norwegians live with their partner and have children with their partner. And so if you use just married in a Norwegian context, you would be understating the amount of social capital. So married or living with partner. Member of religious organisation, church attendance relative to population. Now that's these are all individual variables. Church attendance relative to population is a characterisation of the locality you're in. So what's the level of church attendance relative to the size of the population? Voted, this is an individual measure, voted in the last election, local election. Did you vote in a local election? This may be quite a good measure. Now think of the other ones we've sometimes seen are things like voting in a presidential election. Presidential election is kind of different. Local election tend to have lower turnouts or more variable turnouts because you are voting for somebody to represent quite a small locality. And so it might be a much more sensitive, potentially sensitive measure than things like what we call general elections or presidential elections. Percentage who voted in the last local election, so that's for the area, for the locality, that's an individual variable, this is for locality. Membership of sports organisations and sports membership relative to the population. So you're a member of a sports organisation is an individual variable, and the other one is an area variable for sports membership. So these are all things that have, at one time or another, been suggested to be indicators of social capital. And thus, he's then interested to what extent do they have a predicted effect on, for example, general health or mental health. And again, I've just put in the direction, the sign of the coefficient, whether it's positive or negative, and again, if it's in bold, it means it was statistically significant. So he found most of the things that he had included had a significant impact, except married and member of religious organisation. They weren't statistically significant. Interestingly, however, for this bottom one, sports membership relative to the population, it was a negative impact. Now, that's not what we're expecting. We're expecting if there's higher rates of sports membership in a locality, that's more social capital, there should be a positive effect. Now, he does, economists are quite good at this, ex post, comes up with a justification, and he thinks it could be, if you're in a locality where sports membership is much more the norm, and you're not a member, you might feel as it almost sort of bad about it. and it sort of goes in the other direction. So you feel worse about yourself because there's all these people being wonderfully healthy and going around in lycra and cycles and carrying squash rackets and things. Maybe it's stretching. Sorry, this is individual. So as is the individual whose self-assessed health is being, we're trying to explain, is the individual a member of a sports organisation? And the last one is, what's the level of sports membership relative to the population? 10 per thousand or 200 per thousand people are members of a sports organisation. Mental health, well, these first 5 were all positive, significant relationships. And again, although not significant, you've got this effect of individual and the average in the locality having different signs down here. But it's not statistically significant, so you don't have to worry. He then went on and looked at it using county data for panel data. So the last study, all in the same paper, this study was a cross-sectional study, one point in time, 1998. He then had panel data for Norwegian counties. So you've got multiple years. It's like a multiple cross-section. Again, self-assessed general health, self-assessed general health. Oh, sorry, that should be mental. And he had a more restricted data set because this was panel data over time. The cross-section data was richer. But he had married or living with partner, a measure of church attendance relative to population, percentage voting last local election, fundraising per capita. So this is a sort of people's charitable giving. And he's put no, it's not my typo. Sorry, it's not my typo. It is both general health. The difference was he'd found that these two were highly correlated for some reason. And if you put in 2 variables that are highly correlated, you're not going to estimate you're not going to get a clear estimate of the impact of one of them. So both were general health. In one, he includes percentage who voted in the last local election. In the other, he includes fundraising per capita. And so again, there's some influence here. Fundraising per capita is an interesting one. We haven't seen that before. We've seen reference to volunteers. To what did you engage in voluntary activity? But these are essentially charitable donations. I come from a city in the northeast of Scotland called Aberdeen. And among the rest of the people in Scotland, people from Aberdeen, called Aberdonians, people from Aberdeen, are suggested to be very mean, what we say tight with money. A bit like, dare I say it, the rest of Japan looks at places like Kyoto and Osaka. But according to my wife, she's from Tokyo, so she's biased. Anyway, so people from Aberdeen have this reputation for being mean. But the facts of the matter are, when you look at the statistics, they year after year donate more money per capita than other places. I give you that as background. But the example I would have loved to have given you, but I couldn't get copyright for it, is there's a very famous postcard of Aberdeen where it's split into 2 pictures. And the photograph's actually taken in 1933. And one picture, it's the main street called Union Street, bright sunny day, you can't see a single person. Now it must have been taken very early in the morning. The other photograph, companion photograph, is the same street, absolutely full of people, completely full of people. And the heading is, above one, it says Aberdeen on a home collection day. What they mean is, when people are going around houses to collect money, that's a home collection day. And the other one is Aberdeen on a flag day, and that's when people collect in the street. And if you donate, you get a little pin with you may have them here as well, that says I've donated. And so the flag day picture, when you're going to, the collection's going to be in the street, is the empty street, so everyone stayed at home. And the home collection picture, where everybody's in the street, is everybody's left home because they don't want to have to donate. People come around the house. Anyway, I give you that as a side. It is completely unjustifiable, by the way, I emphasise. Aberdonians are very generous. But it's a lovely photograph. I just couldn't get copyright approval for that. But here is this Norwegian health economist actually operationalising this idea that the level of financial giving might be correlated with health. It might be a good measure of social capital.